What is the role of nebulizers in CF infection surveillance? Imagine a device that helps you breathe easier and fights lung infections at the same time. That's what nebulizers do for people with cystic fibrosis. They deliver medications directly into the lungs to loosen mucus and control infections. But they also have a hidden role in infection surveillance. They are not just treatment tools, they can also be sources of bacteria if not properly maintained. In cystic fibrosis care, nebulizers are essential for giving medicines that improve how mucus moves out of the lungs. This helps reduce the amount of bacteria and other germs that can cause infections. When used correctly, they help keep lung function better and lower the risk of serious infections. That's why they are a key part of managing cystic fibrosis. However, studies show that nebulizers, especially those used at home, can become contaminated with bacteria. Common bacteria involved in lung infections for cystic fibrosis include Pseudomonas aeruginosa and other gram-negative bacteria. Research indicates that more than 40% of home-use nebulizers can harbor bacteria if not cleaned properly. This contamination can lead to reinfection or new infections, making it a concern for infection control. This is where infection surveillance becomes important. Monitoring the cleanliness and microbial status of nebulizer devices is a vital part of managing cystic fibrosis. Proper cleaning, disinfection, and drying of nebulizer parts are necessary to prevent bacteria from surviving and growing. For example, if parts are not dried thoroughly after cleaning, bacteria like Pseudomonas aeruginosa can thrive, increasing the chance of infection. Guidelines from health authorities recommend strict hygiene practices for nebulizer use. These include cleaning all parts thoroughly after each use, disinfecting regularly using methods like steam sterilization, and making sure all components are completely dry before storing or reusing them. Educating patients and caregivers about proper nebulizer care is also crucial. When these practices are followed, the risk of device-related infections drops significantly. Monitoring nebulizer contamination can also help identify potential sources of infection. If bacteria are found on a device, it can lead to changes in cleaning routines or additional education for the patient. This proactive approach helps prevent bacteria from entering the lungs again and keeps infection risks low. In summary, nebulizers are vital in cystic fibrosis treatment, but they need careful hygiene and monitoring. Proper maintenance of these devices is a key part of infection surveillance. By keeping nebulizers clean and dry, patients can reduce the chance of bacteria growing on their devices and causing new infections. This dual role of treatment and infection prevention highlights the importance of integrating device hygiene into overall infection control strategies for cystic fibrosis. Always remember, consulting healthcare professionals for personalized advice is essential to ensure the best care and safety.